Hello, my name is Dr. Brad Boone. I am a fellowship-trained sports medicine surgeon at Eastern Oklahoma Orthopedic Center, and I specialize in treating knee, shoulder, elbow, and sports-related injuries and conditions. In this video, I will be discussing Tommy John surgery. Your ulnar collateral ligament, or UCL, is located on the inside of your elbow. It connects the bone of the upper arm to a bone in the forearm. An injury to your UCL can be the result of repetitive stress or trauma. Baseball and softball pitchers have the highest risk of injuring their UCL because the throwing motion that twists and bends the elbow puts extreme stress on your ligament. After time, your UCL may develop tears stretching to the point where it cannot hold the bones tightly enough while pitching. Symptoms that are associated with a UCL injury include pain on the inside of your elbow, looseness or instability, irritation in your ulnar nerve, and inability to throw. UCL injuries are diagnosed by a history and physical exam. Tests that may be done are x-rays, MRI, and a second MRI after a dye has been injected into your elbow to see if there is damage. A UCL injury can be very difficult to diagnose. Following a diagnosis of a UCL injury, there are many conservative treatment measures that may be used. This type of injury is usually treated conservatively with rest, ice, and non-steroidal anti-inflammatory medication. Physical therapy can help strengthen the surrounding muscles to compensate for your injury. If these methods aren't successful, you may be a candidate for Tommy John surgery. The surgery is named after former Los Angeles Dodger pitcher Tommy John, as he was the very first person to undergo this specific surgery. In 1974, Dr. Frank Jobe performed the procedure on Tommy John. His chances of pitching again were 1 in 100. Tommy John spent 18 months in rehab but beat the odds and returned to the game. Tommy John surgery is the procedure used to repair your injured elbow ligament. It is most commonly performed on college and professional athletes, especially baseball pitchers. It can be done on younger people as well. During this procedure, I will replace your damaged UCL with a tendon graft from another place in your body. Following UCL surgery, your elbow will be immobilized in a splint for approximately 10 days. After which sutures are removed and elbow range of motion and shoulder range of motion exercise will be instituted. Our main goal the first 6 weeks is restoration of range of motion under the guidance of a physical therapist or athletic trainer. Strengthening exercise will start at 6 weeks. At 16 to 20 weeks post-operatively, the arm and the graft is strong enough typically to begin a throwing program under the direction of a trainer, therapist, and pitching coach. To learn more about Tommy John surgery, please visit our website at eooc.com. Thank you.